Welcome to the podcast entitled Health and Wellness Briefs, Tactics for a Better You. I'm Dr. Bernadette Melnyk, Vice President and Chief Wellness Officer for The Ohio State University. This podcast series is brought to you by my CWO office and wonderful Buckeye Wellness team in order to provide you with evidence-based micro-learning modules to optimize your health and well-being. Our podcasts start by taking a dose of vitamin G. Given that vitamin G, or gratitude, is one of the simplest research-based strategies to improve mood, sleep, and optimism, and reduce stress and blood pressure, please take a few seconds now to think about who or what you're grateful for today. Give a dose of vitamin G to someone today for even more benefit. Today's topic is family caregiving for a loved one with dementia. Our wonderful guest is Dr. Mary Beth Happ, a distinguished professor in our College of Nursing and co-director of the Golden Buckeye Center for Dementia Caregiving. Welcome to the podcast, Mary Beth.
Thanks, and thanks so much for having me.
Mary Beth, there are more than 100 million adults in the United States who provide care for a relative, parent, or child, including those people who work full-time. It's startling to think about this as the United States family caregivers provide $600 billion of unpaid caregiving time each year. There's a sandwich generation that exists right now in the United States who have children, but who have aging parents with dementia. From your awesome experience, what are some of the most significant challenges and benefits that caregivers of people with dementia encounter on a daily basis?
Well, certainly the benefits of care, include, the meaningfulness that can occur and the closeness and new perspectives that one can have when providing care for a special person to you, a loved one with cognitive changes. It certainly changes how you view the world as well. But the challenges are many, and the challenges change in different stages of the disease or as the disease progresses. And we know that dementia is an umbrella term for a number of different types of cognitive progressive neurologic degeneration. So Alzheimer's disease is the most common form, and sometimes we use that as an umbrella term, but there are several other forms of dementia: vascular, Lewy body, and frontal temporal dementia that have particular characteristics with behavioral changes that can be quite challenging. So the most common daily challenge is supervision or companionship for the person living with dementia. And recognizing or navigating the changes in those needs for supervision and companionship. So, how long are you, the caregiver, comfortable or feel safe leaving that person alone? Another challenge is in communication as patterns of communication change and our communication behavior is learned. And particularly the way we communicate with people in our family and people who are close to us. So it's habituated and we often aren't conscious of it. But now, as caregivers, we might have to become much more deliberate in how and what we communicate, concerned about triggers or overwhelming the person and not having them fully understand a particular message that we have. At the Golden Buckeye Center, we have ways to train and help families deal with these changes and challenges.
Mary Beth, if I was worried about my parent developing some type of dementia, what would be the earliest signs that you begin to spot? And then where do you go for an initial evaluation?
Well, that's a really good question. And there are ways to distinguish between changes in cognition that are normal aging. We do have some slowing. We do sometimes take longer to process or to remember certain things. But we get there. Or we may misplace the car keys, but we don't put the car keys in the freezer necessarily and are unable to retrace our steps or forget what those are for, even momentarily. It's those kinds of changes or changes that in things that the person would normally know and do very well that now you're seeing, that's odd. Disinterest in an activity or hobby that they loved. Some of the executive function, finances is one of, and computation around finances is a hallmark early sign. Following a recipe.
That's great because I know a lot of people worry about things they're seeing and what is normal aging and what isn't. Now, in terms of practical strategies for caregivers or resources that are evidence-based, what is available out there for caregivers?
The most practical advice about daily supervision and companionship is enlisting a network and really thinking about who does, and I'm talking about a caregiving network, really thinking about who does or can help and what strengths and resources they bring. In a study that I participated in many years ago, there was a family of 3 daughters caring for their father with dementia. And they had what might have been an unconventional system, but they had great rapport and respect for each other. And they had a division of labor and a sharing amongst the 3 of them, which sometimes involved the person with dementia, their father, staying in their different homes. It worked for them, but the part that struck me about this particular family was how careful they were about identifying who could bring what to the table. And they were all juggling in that sandwich generation with work and children and other responsibilities, but they assessed their network. And they also engaged respite care. So they engaged a adult day program for their parent. And those are sometimes takes some convincing to get the person with dementia to agree to participate in a program. But those can be lifesavers in terms of time and energy for the family caregivers. Those programs have taken a hit during COVID, but there's a wonderful organization that catalogs the programs throughout the country. And so through our Golden Buckeye Center, we have access to the catalog of respite programs, of adult day programs available in various regions to family caregivers and the person with dementia.
So tell us more about the Golden Buckeye Center and how people can access it.
Good. Thank you. The Golden Buckeye Center for Dementia Caregiving is funded by the Ohio Department of Aging through the Alzheimer's and Related Dementias statewide resource program. It's part of the state plan on aging, and our objectives are to provide resources for cognitive screening and referral. So you asked earlier about how would we go about assessing or knowing if we have some suspicion? And through our website, you can see tools such as the SAGE tool, that you can self-administer, and ways to referral to your primary care provider or specialty memory clinic for specialty assessment and evaluation. We provide resources for risk reduction and caregiving support. Our ultimate goal is to provide effective outcomes to support family and formal care partners. So we provide training to primary care providers, clinicians about dementia screening and referral, and what those referral entities are in the state. We've offered virtual and in-person trainings and have collaborated with the Alzheimer's Association of Central Ohio to provide those trainings to informal caregivers, both on site and in community-based places throughout Ohio. And we've partnered with the OSU Extension Services to reach all corners of Ohio. Our formal partners include the Alzheimer's Association, Benjamin Rose Institute on Aging, the Ohio Council for Cognitive Health, Memory Lane Care Services, Summit County Public Health, and Miami University Scripps Gerontology Institute. In addition, we collaborate with area agencies on aging throughout the state and county offices of aging, and the African American Alzheimer's and Wellness Association, and as many additional community partners who are interested in supporting information, training, and resources for caregivers of persons with Alzheimer's disease.
Wonderful that this caregiving center was funded. And I would encourage anybody listening today If you have concerns, questions, needs, please check out the Golden Buckeye Center for Dementia Caregiving. Mary Beth, one last question for you. What promising innovations or resources are on the horizon, and anything else you'd like to communicate to our listeners?
Sure. Certainly, there's excitement about the new medications and promise of therapeutics in the future that could slow or halt progression of Alzheimer's disease. This is not my particular area of expertise, and there's a big dose of caution with optimism surrounding the therapeutics. We're still learning about who may be best suited to receive these medicines, but early diagnosis is key. And I think we've seen greater interest in and acceptance of early diagnosis, cognitive assessment, and attention to brain health. It's in the news a lot. And we have friends in their 70s and 60s who, with family histories of dementia, who are really actively pursuing better overall health in service of brain health. And that's fantastic. We also have friends who are eager to volunteer for research, both preventative research and caregiving research. At the Golden Buckeye Center, another part of our mission is to amplify research on family caregiving for persons with dementia. And we've seen people generally amenable to participating in research in that way. And we have developed a research registry for caregivers to provide opportunities to participate in the research. Other areas of excitement are care navigation and support programs for caregivers. There's a new model for eligible Medicare and Medicaid recipients. It's called the Guide model. And this is in partnership with healthcare providers. So for those of you who are providing care for persons with dementia, ask your healthcare provider if they subscribe, if they're a guide model provider. And that provides some additional care navigation and support for caregivers. The Alzheimer's Association has a 24-hour hotline that answers caregivers' questions. And so I would recommend that. There is a dementia-friendly health systems and dementia-friendly communities movement, dementia-friendly workplaces movement, which is educating providers throughout healthcare institutions, providers throughout workplace or people in workplaces about the challenges of dementia caregiving, the fact that the person next to you may be a caregiver, is likely of a number of persons in your workplace being caregivers and having these additional responsibilities, and what you can do to support them and keep them in the workforce and being productive. Music, and I would recommend people to look at the Day by Day project, which originated with students from Ohio State, so alum now at Ohio State. And this is really looking at music and memory and neurologic response to music, and how persons with dementia and cognitive impairment and other neurologic disabilities can access both memory and communication through shared musical experiences. And so I think we're awakening to lots of new inroads, living with dementia more fully. And I think the other support, and not exactly therapeutics, but an innovation, are some of the monitoring systems for home and person that help as aids for the caregivers. So, I'm excited about all of these innovations and things that we can explore to support family caregivers. And before we leave, I really want to have your listeners know where we are located and how to get a hold of us. So the Golden Buckeye Center for Dementia Caregiving has a physical space at 760 Kinnear Road in Columbus. And our 800 number is 800-645-2949. And you can email us at dementiacaregiving@osu.edu. Our website is nursing.osu.edu/dementia caregiving.
That's great. Mary Beth, thanks so much for your fantastic work. And I also want to finish by emphasizing that a lot of caregivers do have mental health struggles because they're dealing with so much very complex situation. So please, everybody, don't hesitate to face that true story if you're suffering from anxiety or depression, and to get help. And very importantly, please remember, you can't take great care of others unless you give self-care some priority in your life, which is challenging being a caregiver. So with that, thank you for listening to Health and Wellness Briefs. Please tune in to our other podcasts to learn more about evidence-based tips for a healthier, happier, and better you.